This video will go over ways of assessing protein status. There are two ways to assess protein status. There are visceral protein status and somatic protein status. Visceral proteins are proteins in internal organs or non-muscle protein, and there are 5 ways to measure visceral protein status. There is somatic protein status or muscle protein, and there are 3 ways to measure somatic muscle protein status. Visceral protein is measured through albumin, transferrin, prealbumin, retinal binding protein, and C-reactive protein. Albumin is a plasma protein, and its normal range is 3.5 to 5 grams per deciliter. Grams is circled because albumin is the only way to measure visceral protein status that is measured in grams. The rest are measured in milligrams per deciliter. Albumin increases with dehydration and decreases with overhydration, inadequate protein intake, protein malabsorption, CHF, cirrhosis, acute stress, or excessive loss such as burns, nephrotic syndrome, and pressure ulcers. Albumin is made in the liver and it makes up 60% of the protein. It decreases with age due to a decrease in liver size. The half-life is 12 to 21 days, which does not make it an ideal candidate for measuring protein status in acute care settings. It is a negative phase respondent, which means that it decreases when there is stress. Transferrin is a blood plasma protein that binds iron in the intestines and transports them to other cells. When iron is low in the body, transferrin increases. Transferrin does not change negative or positively with stress or inflammation. Therefore, you can distinguish anemia of chronic disease versus iron deficiency anemia with transferrin. The normal range for males is 215 to 365 milligrams per deciliter, while females is 250 to 380 milligrams per deciliter. It increases with iron deficiency anemia, pregnancy in the 3rd trimester, and chronic blood loss. It increases. It decreases with protein calorie malnutrition, marasmus, pernicious anemia, iron overload such as in a blood transfusion, and chronic infection. Transferrin is made in the liver and it transports iron. The half-life is 8 to 10.5 days, which does not make it a good indicator of protein for acute care because of the long half-life. Prealbumin is also known as transthyretin or thyroxine binding prealbumin because it carries a T4 thyroxine hormone. The normal range is 15 to 36 milligrams per deciliter, and it increases with chronic kidney disease and decreases with malnutrition, inflammation or stress, or liver damage. It's made in the liver and it's transported in the blood as part of retinal binding protein and vitamin A. Its half-life is 2 to 3 days, which makes it a good indicator of protein status in acute care because of its short half-life. Albumin rather than albumin because albumin has a longer half-life. It's also a good indicator to see if a patient is at risk for refeeding syndrome. Prealbumin is a negative acute phase respondent, meaning that it will decrease when there's inflammation present. Next is retinal binding protein. The normal range is 2.6 to 7.6 milligrams per deciliter. It's increased with advanced kidney disease and decreases with protein calorie malnutrition, vitamin A and zinc deficiency, and chronic liver disease. It's synthesized in the liver and it transports retinol. It is not affected by acute inflammation, so it does not decrease or decrease with inflammation. And its half-life is 10 to 12 hours, which is too short to assess protein status accurately. Next is C-reactive protein, or CRP. The normal range is less than 1 milligram per deciliter. It increases with bacterial infections, inflammatory disorders such as rheumatoid arthritis, lupus, unstable diabetes, and Crohn's disease. And it also increases with acute injury such as a heart attack. It is made in the liver and it is normally undetectable in healthy people. It is a positive acute phase respondent, which means it increases when there's inflammation, unlike the rest of the visceral protein status indicators. There's a negative correlation between CRP, albumin, and prealbumin, meaning that if CRP is increased, albumin and prealbumin are decreased. CRP is not affected by malnutrition unless there's also inflammation present. Now we're going to talk about the indicators of somatic muscle protein status. We have creatinine, anthropometrics, and nitrogen balance. Creatinine. It ranges with each patient, and you can measure creatinine by the creatinine height index, which is CHI, and it's actual urinary creatinine divided by ideal urinary creatinine times 100. CHI increases with physical training and decreases with protein-calorie malnutrition, wasting diseases such as an AIDS, and aging due to muscle mass loss. CHI is a measure of lean body mass with patients with normal kidney disease, and it's an indicator of quality of muscle mass, and the amount of creatinine excreted in the urine is normally constant day to day. If you have greater than 80%, you have mild depletion. If you have 60 to 80%, you have moderate depletion, and less than 60%, you have severe depletion. Anthropometrics. You can use anthropometrics to measure somatic muscle protein status through the mid-arm circumference and the upper arm muscle area, which is used in pediatrics. You can also use nitrogen balance, and that is the nitrogen intake or protein intake versus the nitrogen output or protein output. And nitrogen balance is calculated by using the grams of protein ingested divided by 6.25 minus urinary nitrogen plus 3 grams. This can be 3 to 4 grams depending on what you want to use, and this measures insatiable losses such as feces and sweating. If you have a positive nitrogen balance, there's nitrogen retention, which is known as anabolism. This happens in growing children, pregnant women, when you add muscle mass or recover from an illness. That means that the body is holding onto nitrogen and is not excreting it. When you have a negative nitrogen balance, you have nitrogen loss or catabolism, which is protein breakdown in starvation or protein-calorie malnutrition. When you have a zero balance, that's no loss, no retention, and that indicates a healthy individual.